Water on three sides, amazing views, great fishing.
There are wonderful trails here and incredibly historic buildings that are left over from the military post that was here.
There's a plan in the works to revise Fort DuPont. Right now, it's one of the most underused state parks in all of Delaware. Some buildings are in disrepair, falling down, and just won't be able to be saved. But others, like this beautiful historic theater, have lots of potential.
State planners say a makeover at Fort DuPont could put people to work and bring more dollars to the Merchant District just across the canal in Delaware City.
One of the ideas that seems to be very popular is building a pedestrian bridge right in this area that would link Delaware City to Fort DuPont in a much more convenient way.
Members of the Delaware Coalition for Healthy Eating and Active Living say the benefits of the Fort DuPont plan may include not just jobs, but also public health.
Health was not being explicitly considered, but parks really can provide a great starting point for getting people more active and promoting even some social interactions that can foster better health.
Urban planner Andrea Trebelsi is leading an HIA, a health impact assessment at Fort DuPont. It seems obvious to do a health analysis on a refinery, say, or a busy road. But why bother studying the health effects of a park?
We questioned the same thing, by the way, when we found out that they were going to do a health assessment.
Delaware City Manager Richard Cathcart says these days he's a supporter.
So if they can find some things when they do their walk around today that we can do to make that plan a little bit better, then we welcome that.
The assessment team is documenting missing and broken sidewalks. They're mapping bus routes and counting up the closest places to get health care. But Trebelsi says, as the Fort DuPont redevelopment becomes a reality, the coalition may need more data to convince state officials.
Without a complete story, it's hard to draw really hard conclusions.
In Philadelphia, planners used a health impact assessment to analyze a proposal to extend the subway line.
This is the last stop on SEPTA's Broad Street line. Thousands of people work just down the road at the Navy Yard, and city planners in Philadelphia have big dreams of connecting them to public transit.
City planner Clint Randall says right now, 4 out of 5 Navy Yard employees drive to work. But getting people out of their cars and onto the train could promote physical activity.
Are you able to reach your job and other daily essentials, on foot or by bike or using mass transit? Do you have a convenient place to go to the supermarket or to go play with your kids in the park?
For its health impact study, Philadelphia surveyed workers.
If there was a train that would take you right there, would you take it? Would you take it all the time, some of the time, etc.? And the same thing for walking and biking. The star here on the map is the Navy Yard. What we have on the map here are the different counties and how the current transit system provides access.
Navy Yard commuters log 50 million vehicle miles each year. Without the new subway extension, that number could climb to 90 million, as the Navy Yard attracts more and more young urban professionals. Randall said that means more acreage dedicated to parking lots and more motor vehicle pollutants that worsen asthma and heart disease. He's hoping Philadelphia's HIA helps the city win new money for transit projects.
We're trying to get people excited, elected officials excited about the project, and producing data that's going to help us make our case to federal or state funds.